Okay, so today we're talking about Parkinson's disease. Listen up, this one's important. What is Parkinson's? Parkinson's disease is a progressive neurological condition of the brain. That means it affects the brain and slowly gets worse over time. Symptoms. So, what does it look like? People with Parkinson's may experience memory problems, tremors like shaking in the hands, slow movement where simple actions take longer, reduced balance which can cause falls, rigidity or stiff muscles, depression affecting mood and emotions. Not everyone has the same symptoms and they can start slowly. Causes. Here's what's happening inside the brain. Nerve cells in an area called the substantia nigra, which is part of the basal ganglia, begin to reduce. Because of this, the brain makes less dopamine, a chemical that helps control movement. When dopamine levels drop, the symptoms of Parkinson's appear. Risk factors. Some things can increase the risk of Parkinson's, like exposure to pesticides, genetics, meaning it can run in families, being male, or being over 50 years old. Having these doesn't mean someone will get Parkinson's, it just raises the chances. Diagnosis. There's no exact test for Parkinson's disease, and because many conditions have similar symptoms, doctors look at the symptoms, a DAT scan, an MRI scan, or a SPECT scan. They put all the information together to make a diagnosis. Treatment. Right now, there's no cure for Parkinson's, but treatments can really help manage the symptoms, such as physiotherapy, speech and language therapy, medications like levodopa or dopamine agonists, and psychological methods for mental and emotional support. The end. That's Parkinson's disease. Simple, clear, and easy to understand. Follow us for more amazing topics, because learning doesn't have to be boring.